already. Good Lord. So we're starting out crazy already. I apologize. Oh, no, it is the right day. I just forgot to change this. So forgive my craziness this morning, but today is Thursday, August 7th, and I appreciate all of you joining in. As most of you know, we run these webinars every Thursday at 9:30, and the reason that we run them is really just so that you have a place to come as an open forum to ask questions or to listen to others ask questions that you may have had happen to you. So again, we're treating it as really an education service and a learning service for everyone. Because we have a few new users on today, or listeners on today, I wanted to just kind of take a few minutes to kind of regroup and let you know who URL is if you're not familiar with us. Our website is urlinsgroup.com, and I encourage you to visit it because we do have a lot of information on our website that I think you'll find helpful. Just as a recap, Annuity Solutions with Joe Corio, he runs the division, and he takes a unique approach to annuities in that it's really more of a boutique sort of approach where he helps you find the opportunities and kind of walks you through the process of writing annuities. So if you have any annuity issues or opportunities, I would encourage you to reach out to Joe Corio, our Senior VP, and he can certainly help you. Life Markets is run by Steve Clemens. He's the VP of the Life Markets Division. He and his staff have really had tremendous success with not only reaching out to the senior market, but also to the under 65 market with final expense and term life and various other life insurance products. So again, if you have life insurance needs, I would encourage you to reach out to Steve. And then, of course, our Senior Care Products Division, they're getting ready to ramp up for their annual election period. And Karen McDaniel heads up this division. She's a wealth of knowledge, and, this is really a good area for those working in the under 65 market to either explore if they haven't already, or, just go hand in hand with the under 65 market, because with the amount of seniors turning 65 in the next several years, typically there's always an underage spouse that's left behind. So I always refer to it as like a twofer. You get a senior client, and typically you get an under 65 client that you can assist with, and then also when they turn 65, write them the Medicare products. Last but certainly not least, we have our Health Plan Options Division. That is kind of run in a bit of a different way because there's so much product information. So we kind of divide it up. Christy Saul and myself, we split the division. Christy really specializes in the self-funded group market, the ancillary lines such as individual critical illness, individual gap programs. But, again, there's a lot of information on our homepage, our Health Plan Options homepage. The product information tab, you can see there are FFM, federally facilitated marketplace forms that you have access to, and then all of the individual supplemental carriers, all of the individual health carriers, group ancillary, group health, and then long-term care carriers. So again, there's a lot of information on our website, and for those of you that are familiar with URL, I apologize for repeating everything that you already know, but I did think it was important just to take a few minutes to kind of get everyone familiar if they're not familiar with URL. So that being said, we're going to start right in with our agenda, and as many of you know, because our first FFM certification session is today, they are starting. We're running 8 this year. We have 5 of them being held here at URL, and you can check our homepage at urlinsgroup.com for dates and times. And then we're running 1 in King of Prussia, 1 in Wilkes-Barre, and then 1 in Monroeville in the Pittsburgh area. So these sessions really were designed to just be your support, and that's exactly what we're doing. We're supporting you in helping you get through the required modules if you want to sell either individual and group on the healthcare.gov site. So again, I encourage you to look at those sessions. If you've done the modules yourself, then that's all well and good. There's nothing more that you need to do as far as coming to these sessions. But again, we're here to help, and we want to make sure that you have the support that you need to get through the training that is required. So again, if you need that extra support, go ahead and register, and we're happy to help. There was some information that came out today onto our next bullet point about the individual mandate tax. And as we know, it's all kind of been a little bit hazy, but detailed information did come out from the IRS this week. And nothing really shocking. It is as we knew it was going to be. For 2014, it's $95 per person, up to 3-person max per family, which is $285, or it's 1% of your income. But that 1% is capped at the average bronze cost. So what that means is, and it's the greater of the two. So what that means is that if you fall into the 1% of your income category for the individual mandate tax, then an individual's maximum penalty tax is capped at $2,448. Or for a family, it's capped at $12,240. So again, if you look at the 1%, that $12,240 per family, they'd have to really make $1.2 million to even be in that category. But again, I thought it was important to share. Also, there is a tax filing threshold of $10,150 for an individual. So if you do fall into that 1% category, only the amount of the income above the tax filing threshold of the 10,150 for an individual will be used to calculate the penalty. So, again, as we get through these things, as the tax laws are starting to come out, we'll probably get additional information. But again, I wanted to share what we had so far. There was also an interesting article that came out talking about the open questions that are slowing the PPACA exchange revamping. Healthcare.gov is being revamped, and HHS has hired Accenture, or Accenture, however you want to pronounce it. But they are becoming, it seems according to this article, frustrated because of the lack of direction. They were hired to really revamp the financial system, the financial portion of the healthcare.gov, and according to this report, as of June 5th, CMS has changed Accenture's original development contract 6 times. So, that to me indicates that we're going to be in for a rough ride again for the 2015 enrollment. So, I guess I'm mentioning it more as a warning that we had hoped that all of the system issues would be corrected and we'd have ease of enrollment, but it doesn't seem like we will have that. So, again, we'll just work through this together, and hopefully they'll make some quick changes. There's also information, as we know, in Pennsylvania, the same-sex marriage law was upheld. So the carriers are now starting to respond to that ruling, and Governor Corbett is not going to veto or challenge that law, if you will. So essentially, same-sex marriages are going to be treated as a qualifying event within 60 days of really as of August 1st, 60 days. So they can qualify as a qualifying event. There are certain parameters for both group and individual. So if you do have any clients that fall into the category of now being married and same-sex marriages, just give your case manager or myself a call, and we'll let you know what that particular carrier is doing and how we can get your client's spouse covered. The next bullet point is, kind of just a precursor, and again, maybe a bit of a warning that the renewal strategy for all of the clients that you've either enrolled on the FFM this year or will have to transition to an FFM plan, the renewal strategy is a bit vague, but it does appear that NAHU, and this is going to be included in my newsletter, NAHU is working with HHS to really help make sure that the renewal strategy is as easy as possible, because the last thing all of us want is for anyone to be auto-renewed into a plan they don't want, or go into the system and your name being removed. So, again, this is going to be a work in progress as time goes on. Closer to January 1st, we're going to have a lot more information. So again, just keep tuned. We're going to help you through this as much as we can, but it is, again, going to be a bit of a challenge for all of us. On a great note, I wanted to talk a little bit about our next bullet point. Sam Bohr is now working with URL. He has been hired as the Director of Ancillary and Supplemental Products, and we really felt that it was so important, especially in this atmosphere in health insurance and with the groups essentially dissolving group health coverage, to really try to capture some of that opportunity. And Sam comes to URL with many, many years of experience. He is a wealth of knowledge in the ancillary and supplemental product lines. So I would like you to reach out to Sam for any opportunity, or maybe to even have him talk to you about what opportunities are ahead for you, so you can kind of start looking at your client base and seeing where these products might fit. But again, just backtracking a little bit, if your groups decide to dissolve group health coverage and send everyone to the exchanges or to individual coverage, many employers really do feel a paternal sort of obligation to offer some group health, some group health. So when they get rid of that option, a lot of the employers are looking at ancillary coverages such as group life, group disability, group gap programs. The opportunities are many. So, again, I wanted you to at least be aware that Sam is here now. He's going to be, a true partner of you, our agent partners, and help you grow your block and again, look for those new opportunities. But I have Sam on the call right now, and I wanted him to just introduce himself and say hello.
Well, good morning. Thanks, Deb. I really don't know if I have to introduce myself. That was so good. But you're right. Ancillary and voluntary sort of has always been a big market. But since healthcare reform and like you mentioned, some of the groups dissolving, more and more brokers are looking at cross-selling. So what we're trying to do here as a department is give you that resource so that you can come and ask questions. We just had I think it was a 20-person group dissolve, and they went to a group critical illness and accident plan. The employer wanted to pay for it for the group, sort of in exchange for sending them to the exchange on their own. So the employers are still wanting to offer some type of benefits. And another group yesterday just said, I don't think the employer is going to want to pay for a short-term disability. They just don't have the funds right now. And it's a small group, it's 10 people, but I asked the agent to ask if they would consider making it voluntary. And the answer is yes. They have no reservations of making the benefits available to their employees if the employees are going to pay for it. So there's a new opportunity as well. So internally here, we've got new carriers. We have new contracts. We're looking at enrollment options and the use of technology to make this easier on you and allow you to spend more time face-to-face with your clients instead of trying to figure out how to submit a case or how to enroll a case. And we even have released a quote portal so you can send a quote to us online using a drop-down menu. And then there's a few buttons where you can upload your plan documents, a census template that we provide for you, and you can send it to us. So we're really trying to make it as easy as possible for all the agents to get into this business. And hopefully just reach out to me. My extension here at URL is 134, and I'm sure that we'll be able to get the information out in a blast in the next few days, so you'll have more information on the new department. So thanks, Deb. Thanks for the airtime, and thank you, everyone.
Thank you, Sam. Yeah, I mean, just to reiterate, we're so excited to have him here. Honestly, he's such a wealth of knowledge, and I really do think it's going to be a great way for you to not only get new clients or get another line of coverage in for your existing clients, but also supplement your income, increase your income, which is all important to all of us. So we're happy and thrilled to have Sam here. The next bullet point is just a real quick one. Assurant will be on the FSM for 2015. I don't know what that means for plans, for pricing, or anything like that, but I do know that in Pennsylvania they will be on the healthcare.gov portal and have ACA compliant major medical plans. So, again, the more carriers we have in here, the less of a monopoly and the more choice that your consumers will have. So I think that's actually a positive thing. So, again, for those that are new, each week we have an open forum. If you want to raise your hand, you can do that by just clicking on the little hand icon on your control panel to the right of your screen, or you can go to the question box and type a question in. What I'm going to do now is open up the floor for questions. I'll read the submitted questions and go ahead and answer them. But again, just a little bit of housekeeping. Our next webinar is Thursday, August 14th. So I encourage you to join in there because, surprisingly, there's something new to talk about every week in this rapidly changing market that we're in. Jules asks the question, do we know anything about renewal commissions? And we do not. Some of the carriers, when they came out with their 2014 compensation packages, did give information on what the renewal commissions will be. Some of the carriers didn't. Independence, Blue Cross, we don't know what the renewal compensation is going to be. We don't even know what 2015 compensation is going to be. And for NEPA, we also don't know. So, the answer is no, but hopefully we'll be getting additional information as we get closer to 1/1. John asks, where can we find the information to review the tax mandate details that you talked about? Good question, John. That's actually going to be in my newsletter as well, so you'll find out about that. There is a new line on Form 1040, it's line 61, and that's where your clients and their tax preparers are going to have to address whether they are covered or not. But again, it's in my newsletter this week. Abby asks, have carriers mentioned when they may have 2015 rates available for on and off exchange plans? That's a really great question, Abby. I can tell you my feeling is that they're probably going to hold tight to them again until November 15th, unfortunately, because, as we know last year, the enrollment opened 10/1, and that's when we got the information on plans and pricing, because the carriers did have to file their plans and pricing already, but I think because of the competitiveness within Pennsylvania, the insurance department is holding on to those rates as directed by the carriers so that there's no last-minute switching and nickel and diming, if you will. So I expect close to 11/15, unfortunately. Daniel says, what is the advantage of certifying on the exchange? And, well, that's really a great question, Daniel, because the advantage of certifying for the exchange really means that anyone that is eligible for a premium subsidy has to go through the exchange in order to obtain that premium assistance or the cost-sharing subsidies. So certifying on the exchange opens up the opportunity for you to just really increase your client base, because everybody up to 400% of the federal poverty level, which means for a family of 4 for 2014, about $94,000 a year, a little over $94,000 actually, can qualify for some sort of premium assistance. It's been determined, I think, in the 80% tile that most people would qualify, 80%-ish would qualify for some sort of subsidy. So if you don't qualify or certify, then essentially 80% of your client base is going to be eliminated from you. And PPACA stands for Patient Protection and Affordable Care Act. You hear it as Obamacare, the ACA, Affordable Care Package. I mean, so but PPACA is actually the acronym for Patient Protection and Affordable Care Act. Margie says, how soon will group renewal rates for 12/1 how soon will they be available? And what we're hearing from the carriers, since most of the groups renewed for an early renewal on 12/1, we're hoping, or they're hoping to get them to us late August or first week in September. So that's all we have at this point. Hopefully that will ring true. Janet says that she has clients asking why group rates are more expensive than individual rates. Can you help me with explaining this to them? Everything that I have read really pertains to pre-PPACA. Well, and I think that pre-PPACA has had an effect on group rates, because if you think about it, groups have always been guaranteed issue, and certainly carriers, even though they were medically underwritten on the under 50 market, carriers had the ability to rate up. But I mean, in Pennsylvania, we had the ability to rate up to 200%, and sometimes that 200% is just not enough to cover those claims costs. So from years and years, in my estimation, you know, the rates have increased because of the risk pool. Not only that, but the group has always had to have, you know, more provisions, more mandates, because they are a group plan, such as maternity. They have COBRA options. So there's a lot of things that go into group that, in my estimation, make it more expensive. And pre-PPACA, with the medical underwriting on the individual, you know, that's really kept the rates low, because as we know, before 2014, it was pretty stringent and difficult to get an individual through medical underwriting. So I think that all contributes. I do think as time goes on and closer to 2017, we're going to see the rates for individuals and groups really fall in line. And Tracy says, a couple weeks ago you stated that one of the carriers have a cutoff if you are not listed as the BOR. Can you please tell me what carrier that was again, so we can get a list to Brandy? And Brandy Coleman is our commission specialist. And that carrier, Tracy, is NEPA. If you have written a client through the marketplace, healthcare.gov, and you've not received commission for that yet, it's very important for all of you to go through that list of your clients, because NEPA will not accept an authorization to make you the broker of record to hook you up with that case later than 90 days after the effective date. So again, it's pretty important to go through that list and make sure that all of the clients are accounted for. Daniel says, if you're using the same company and you're on exchange, is there going to be 2 different quotes or only one? I'm not sure that that is, I understand your question, but there are a couple ways to obtain rates, and I'll try to kind of answer it in a blanket way. Individual health rates for most carriers are the same on and off exchange. So you can essentially know what the rates are on or off. Different carriers, of course, have different plan designs with all of the metal levels. So, I mean, there are different rates for each carrier, but not different rates on and off exchange for most carriers. So I hope that helps explain it. If not, please give me a call, Daniel, and I'd be happy to answer your questions in more detail. So again, this is going to be the end of the questions, it looks like, but if you have a few seconds, you know, to type in another question that's a burning question, go ahead and type it in. If not, I'm just going to wrap it up. And again, thank you all for joining in every week. Thank you for the business and the partnership. Again, reach out to Sam. I do think there's some new opportunities for you there. And hopefully you'll join back in next Thursday at 9:30. Until then, have a great day, great week, and a great weekend. Bye-bye.